A 15-year-old sustained a right-sided Erbs palsy injury during dance class. While performing a shoulder roll, the shoulder became overstretched and overused from multiple attempts, sustaining an injury. Erbs palsy is most seen in babies during difficult births and breech deliveries, but it can also happen at any age due to accident or trauma. There are some occupational performance concerns in the area of dressing and leisure participation of dance classes. Poor shoulder and elbow extension and flexion will make dressing difficult. Due to the injury, it will be difficult to participate in leisure time of dance class until therapy has started. Occupational performance strengths include the use of her other hand to make up for the affected side, plus her strong family support system, showing signs of good progress to be made. The first underlying factor of the diagnosis that will need to be addressed during the assessment and intervention plan is range of motion, to identify if there is a total or partial loss of movement. Erbs palsy can cause deficits in flexion and extension of the shoulder and elbow. Second, the sensation in her affected arm will need to be assessed. Erbs palsy causes loss of sensation in the affected side. Poor sensation can lead to further injury as the client is not aware of the arm hitting objects or responds to surfaces that are too hot or too cold. Lastly, fine motor skills will need to be compared between both hands to assess the amount of damage we are working with. The waiter's tip position associated with Erbs palsy is a sign of decreased use of hand extensors. The biomechanical frame of reference will focus on remediating the upper extremity to increase strength and endurance that are limiting occupational performance. Therapy has the potential to address the impairments utilizing therapeutic activity. The family will also go home with stretches and exercise to maintain and restore movement. The neurodevelopmental frame of reference will focus on movement impairments such as movement alignment and muscle strength. Handling techniques with manual force and directional cues will decrease compensatory movements and correct utilization of the affected arm. The Canadian Occupational Performance Measure will be the top-down approach utilized to assess problems in occupational performance. This test will address self-care, productivity, and leisure, addressing all the occupational performance concerns. The BOT2 is the bottom-up approach that will most benefit the client. This assessment will assess fine and gross motor skills on the left and right arms to compare the level of deficit to the client and to the norms provided by the test. For the first goal, client will increase right upper extremity range of motion to 60 degrees for self-dressing, with minimal tactile cues, utilizing adaptive equipment as needed in 2 out of 3 trials. This will be measured by completing goniometer measurements bi-weekly to assess the difference in range of motion. In the second goal, client will increase weight bearing on right upper extremity to 3 minutes to increase strength for leisure participation with moderate assist using elbow brace within 2 months. This will be measured by comparing the amount of time the client will tolerate weight bearing between sessions. The outcome for Erbs palsy is very positive. Mild to moderate cases usually resolve in a few months. With lots of therapy and keeping up with her stretches and exercises, our client will be back to dancing in no time.